Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Social Functioning Questionnaire assesses an individual's ability to perform daily social roles and interactions. It evaluates areas such as family relationships, work performance, and social activities. The main purpose is to identify impairments in social functioning that may result from mental health disorders, including depression and anxiety. The tool aids clinicians in monitoring social disability and guiding treatment plans. It provides a standardized measure to detect changes over time in social adjustment and interpersonal skills. The Social Functioning Questionnaire is primarily indicated for adult patients experiencing psychiatric disorders, including depression, anxiety, and schizophrenia. It is appropriate for populations where evaluation of social functioning is critical to treatment planning and outcome assessment. The questionnaire is most useful in outpatient and primary care settings to monitor changes in social performance over time. It serves as a brief screening tool to identify social impairment and guide further comprehensive assessment or intervention. Studies demonstrate its reliability and validity in detecting functional deficits related to mental health conditions, making it a valuable instrument in routine clinical practice. The Social Functioning Questionnaire consists of 8 items designed to assess an individual's perceived social functioning over the past week. Each item presents a declarative statement related to social activities, relationships, and role performance. Respondents select one of 4 response options reflecting frequency or degree of agreement. The options range from responses indicating optimal social functioning to those suggesting impairment. To administer, present each question sequentially, ensuring that the respondent understands the response scale. After completion, assign scores from 0 to 3 for each item, with higher scores indicating greater difficulty in social functioning. Sum the item scores to obtain a total score ranging from 0 to 24. A total score of 10 or less typically indicates satisfactory social functioning, while scores above 10 suggest varying degrees of social impairment. Scores above 20 signal severe dysfunction and may warrant further clinical evaluation. Interpretation should consider the respondent's clinical context and possible comorbid conditions influencing social engagement. The Social Functioning Questionnaire demonstrates a sensitivity of approximately 85% and a specificity near 75% in detecting social dysfunction. Sensitivity refers to the instrument's ability to correctly identify individuals who truly have impaired social functioning, indicating that 85 out of 100 affected individuals would be accurately detected by the SFQ. Specificity denotes the capacity to correctly recognize those without social impairment, meaning that 75 out of 100 individuals without dysfunction would be correctly classified as such. In a clinical context, a high sensitivity ensures that most patients with social difficulties are flagged for further assessment, while reasonable specificity reduces the number of false positives, minimizing unnecessary interventions. The Social Functioning Questionnaire was developed in the late 1990s as a brief instrument to assess social functioning in clinical and research settings. Initial validation studies by Tyrer and colleagues demonstrated strong internal consistency with a Cronbach's alpha of 0.85 and good test-retest reliability over a 2-week interval with a coefficient of 0.81. Construct validity was established through significant correlations with established measures of social adjustment and psychiatric symptomatology, including the Social Adjustment Scale and the General Health Questionnaire. Subsequent research by Picardi and colleagues further supported the questionnaires' utility across diverse populations, reporting sensitivity and specificity values exceeding 80% for detecting social dysfunction in patients with mood disorders. Factor analyses consistently identified a coherent, single-factor structure underpinning the measure. Cross-cultural adaptations have also confirmed metric equivalence, enabling its application internationally. Overall, these validation efforts underpin the social functioning questionnaires' reliability and validity as a concise tool for assessing social functioning in clinical practice. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.